This video is for educational purposes only and does not replace official training, local protocols, or medical advice. Always follow your specific agency guidelines and medical control. Imagine your body has a built-in alarm system. When you get hurt, the injury sends a tiny electrical pain message rushing up your nerves, into your spinal cord, and straight to your brain, making you yell, "Ouch!" Morphine sulfate is a super strong medicine that paramedics carry in ambulances to act like a giant mute button for that alarm system. Here is exactly how it works, when it's used, and why it can be dangerous. 1. How it works. The gatekeeper, mechanism of action. Inside your brain and spinal cord, there are tiny landing pads called mu-opioid receptors. Think of these receptors like special locks on a gate, and your body's nerve signals have to pass through them to deliver the pain message. When a paramedic gives a patient morphine through an IV, the morphine molecules float through the blood and act like a perfect skeleton key. They slide into those locks and click them shut, blocking the signal. Once morphine locks onto the receptor, it stops the nerve cells from releasing chemical messages. The result: the injury is still there, but the brain never receives the message. The pain fades away into a dull blur, and the patient feels very relaxed. 2. When paramedics use it, indications. Because morphine is so powerful, paramedics don't give it out for a bumped elbow or a small scrape. They save it for severe, unbearable pain. Big injuries, broken legs, severe burns, or bad accidents where the body is in shock from pain. Heart attacks. If someone's heart isn't getting enough oxygen, it hurts terribly. Morphine helps stop the pain and actually relaxes the blood vessels, making it easier for the tired heart to pump. 3. The side effects. Medicines don't just go to the spot that hurts, they travel all over the body. When morphine lands on receptors in other organs, it causes side effects. The brainstem, it makes people very sleepy and dizzy. The stomach, it tells the digestive system to freeze. This makes people feel nauseous and can cause them to throw up. The skin, morphine causes the body to release a chemical called histamine. This makes the patient feel warm, flushed, and super itchy, even though they aren't having a dangerous allergic reaction. 4. The red lights. When it's too dangerous, contraindications. There are times when a paramedic will look at a patient in pain and say, "I want to help you, but morphine could kill you right now." These are called contraindications. Low blood pressure, hypotension. Morphine relaxes blood vessels, which makes blood pressure drop. If a patient is already bleeding internally or has low blood pressure, morphine can drop it so low that vital organs don't get blood. Head injuries. If someone has a severe head injury, doctors need to check their pupils and see if they can stay awake. Morphine masks these brain signs and makes it impossible to tell if the brain injury is getting worse. Trouble breathing. This is the biggest danger. Morphine tells the brain's breathing center to slow down. If a patient is already struggling to breathe, like from a bad asthma attack, morphine can make them stop breathing completely. The paramedics' backup plan. If a patient stops breathing because of morphine, paramedics carry a special rescue key called naloxone Narcan. It rushes in, kicks the morphine off the locks, and instantly wakes the patient's breathing back up.